In the past, they would take all comers with stage 1 or stage 2 or stage 3 cancer and treat them all the same. The stage is how far the cancer has traveled. In the era of personalized medicine, we actually know now that those stage 1 and stage 2 and stage 3 patients, within each one of those groups, there are very different types of cancer within those groups. And we now treat people not on stage alone, but on the different features of the cancer within each group. That's a more personalized approach than just treating the whole group as the same thing when it's not the same thing. It's a heterogeneous or different group of patients. The mechanisms that make cancers grow have been discovered, and the way that we decide what treatment to give a patient for their cancer is based on what is making that cancer able to grow. And we look at certain features of the cancer to determine what's the best treatment. An example would be if the tumor is sensitive to hormones, we might use hormone blockers as part of the treatment to kill cancer cells. Another example of personalized medicine is the genetic evaluation of a tumor. There might be a gene in a tumor that's mutated, and that's what's allowing the cancer to grow. And there are these panels of tests that you can do on the actual tumor tissue that will tell you what mutation is the problem, and then will also tell you what drugs are available that we can use to target that. And with these genetic profiles of tumors, we can sometimes determine whether a patient really needs to have that treatment or not. And that's a good thing for patients, because a patient might avoid chemotherapy that they would have gotten in the old days when we didn't have those tests, but they would be offered that treatment of chemotherapy if it was going to benefit them greatly. It's a smarter way to treat cancer now in this era, because we have more information that we can actually translate into the clinic to help patients.